everyone. Thank you so much for joining Dr. Beck and I for the Fertility Financing 101, Ways to Pay for Your Fertility Treatment, and also focusing on the LGBTQ community, egg donation, surrogacy, so many topics we're going to cover, right, Dr. Beck?
Absolutely. I'm excited.
Yes, so am I. So we are going to get started on the webinar. I'll go ahead and share my screen. And I will also go ahead and tell you guys while I'm doing this that while we're doing the webinar, while we're talking with you, please feel free to go ahead and put comments over in the comments section, questions that you may have, things you may be interested in hearing a little bit more about, as well as any questions you have. We'll be answering those at the end of the webinar, okay? So I'm excited. I want to get started. I would love for anyone that is on with us to go ahead and put where you are in your treatment right now. Where are you and what are you looking to do to move forward? That would be amazing. Also, keep in mind that the webinar is available for you to rewatch after we're done with the webinar, and it is recorded for you so that if you are missing maybe some words on the bottom of your screen, if you will go to a bigger monitor, that helps tremendously to be able to see the entire slide, because if you're watching on a phone, sometimes it can be a little bit difficult to see. So again, welcome everyone. We are beyond excited to be sharing this event with you and all of the information that we have to share. So as we were talking about, we're going to cover a little bit of everything. We're going to talk about the different fertility treatments that you could be having, focusing again on LGBTQ+. I will say that Dr. Beck and I have just had this conversation that we don't celebrate Pride Month, we celebrate Pride Year all year long. So we wanted to make sure, right, that we focused on this not only in June, but that we show everyone that everyone deserves to grow their family and that we're here to help you to do that. Now, we're also going to discuss how you may want to be paying for those fertility treatments. And a couple of different ways. We'll show you all of the ways that we know of to pay for your treatment. And then we'll also talk to you a little bit about future family, of course, and how that may be a little bit different for you if you choose to move forward with us. So I'm Jenny, and I'm kind of like it says here, your go-to girl for future family. I will be happy to answer any questions you might have and happy to walk you through the process of looking at your options as a loan. And I'm also a clinic success manager, which means that I get to work with all of the fabulous people at HRC, including Dr. Beck, and get to work with them. And I'm going to tell you, choosing HRC is one of the best decisions you've made. They're a phenomenal clinic. Every location is got the best care. They really focus on the patient, the individual, not just patients in general or the field in general. It's each patient. And I hear this over and over and over again from other HRC patients. So beyond excited to be doing this with you, Dr. Beck. And we will get to the fertility part of the discussion in just a moment. But I wanted to let everyone know, just like I was just saying, how we work together so well is that we do take each patient as an individual, and each individual gets a different treatment plan, obviously, from you guys, right, at HRC, and each patient gets a customized and individual loan from us as well. Nothing is cookie cutter here. So there's a lot that we have to discuss, right? There's a lot having to do with your treatment plan. There's a lot of information coming from the finance side of it, and how are you going to pay for this treatment? It's a lot. And I like to call it the fertility fire hose. So every once in a while, I want you all to know to take a deep breath. You have got two great entities here that have your back. HRC for your medical health, Future Family for your financial health, and we have you. And I promise you that we will continue to have you as long as you will have us. So, handful of ways that you can pay for this treatment. First is going to be savings. Savings is a good option. It's not the best. Now, I think COVID has taught us all that savings is there for a reason, and savings is there for that major reason for things like maybe a car repair or a home repair or an unexpected cost that's popped up. So please if at all possible, leave your savings where it is. Let that savings be that cushion to fall back on so that you don't have to worry about, if you use all of this on fertility treatment, what am I going to do now when I have something really come up and my credit might not be as healthy as it is right now? Now, option number 2 is the credit card. Honestly, one of my favorites. I love a good 0% credit card, better than anyone else probably on this entire call, but they do have their place as well. So please be aware, if you're going to do a 0% credit card, be aware of how much those payments are going to be. Can you handle them no matter what happens, no matter what falls in your plate? Can you handle those payments? Because if you can't, that credit card is going to dump fees on you, that interest rate's going to go sky high. Just be super careful. We have a lot of patients contact us and say, hey, listen, I'm about to default on this and my interest rate's about to go sky high. Can you help me with a loan? And some were able to help, some were not. Most we are. So I will just say, don't get stuck in that situation. Really be smart about what credit cards you use. HELOCs are amazing. Love HELOCs. If you already own a home and you've already got a HELOC, this is a great option for you. It's a low interest bearing loan, so you can definitely use this to pay for your treatment. And it is a very financially smart and financially healthy way to pay for your treatment. Now, if you don't own a home or if you have not applied for a HELOC yet, it is very time consuming to get the HELOC. So we always suggest that if you want to move forward with treatment, go ahead and get a loan through Future Family, still apply for the HELOC, and once you've got that in place, if the interest rates are much better, then just pay off the Future Family loan with your HELOC, and it works out beautifully. You can still move forward with treatment, not delaying your future, and you can still get that low interest rate. Now, retirement. Retirement is a tough one because we all think, we earned it. Shouldn't we be able to use it? Well, it's use it now or use it later. So if you do this, you're going to have penalties. And if you do this, you're going to have to work longer and harder. So that's kind of like your savings. Leave it where it is if at all possible. And then you will be able to have that for later down the road when you're getting that reward of how hard you've worked your whole life, right? Fertility grants, another favorite of mine. Absolutely love fertility grants. Please be very detailed. Look at them, make sure they are going to pertain to your care, your treatment plan. And also make sure that you have the time to do it. It's very similar to a HELOC. It takes a good long time to get those grants moving. So similar advice, find the funds from some other avenue and then come back and use that fertility grant to pay that off. And then, of course, my favorite topic, right? The fertility loan, because that's how we can help you. And I do know how easy it can be and how helpful we can be. So I'd love to talk to you a little bit more about Future Family. So we were created by this amazing woman, Claire. She is an IVF warrior. She went through 6 cycles of IVF to have her 3 beautiful children with her husband. And she knows IVF. And after going through those treatments and having her children, she said, I really want to do something to come back into the world of IVF and fertility treatment and make it a kinder industry for people. Medical professionals do that from day one. They're amazing. You guys step it up. You help these patients through both the emotional and the physical and the mental and the health side of everything. We wanted to do something to also affect and also de-stress this part of the journey, right? It's a little bit tough when you look at that big invoice and you go, I don't know if I can do this. You can. I promise you. With our support, you can. There's not a step that you go through with Future Family that isn't hand customized, hand touched by Claire. And the steps would be you going into our website, you click the Get Started button, and that starts your pre-qualification. Now, the pre-qualification is as it says here, no risk and worry free. Claire wanted to make sure that if anyone came in to take a look at us and looked at us for an option for their payment, that it didn't damage their credit to do that. It is super important to her that you get all of the options out there without having that damage. You also get an instant result. The application takes about 90 seconds to complete. It is that simple. If you want to add a spouse or partner, it's going to take you about 2 to 3 minutes. Spouses or co-applicants can be spouse or partner only. It cannot be a family member, sadly, but we do have an option for that, which I will get into in just a moment. Our loans are 2 to 5 year term, and the loans begin at 5.99 and go up from there. Our average is about 7.99, 5.99. And I always say go with a full 5 years because there are no prepayment penalties. Another Claire favorite. You can pay this loan off the day after you get it if you want. It's not going to hurt our feelings one bit. It's actually going to make us very happy to know that you've done this and been taking care of everything quickly. One easy payment. You can take your HRC fees. Now, as you know, medications are included, or you may not know, in the HRC packages, but PGT lab cost, everything that has to do with your fertility and the related cost can all be put into one loan. And then we take one payment, automatically drafted from your account, and that's how you pay down your loan. You also have someone who pays those entities for you. So we pay HRC, we pay your lab, we take care of all of that for you. It again reduces the stress, right? And last but definitely not least is the personal fertility coach. This is a registered nurse. You're going to have your own specific registered nurse that's going to be able to answer any questions you might have. You'll have their phone number to text, you'll have an email, and you'll also be able to call them. All of those avenues are ways that you can ask those questions. I like to call them kind of like the girlfriend that you have that knows a lot about IVF. So where they will not give you very specific medical advice, that is what HRC is for. They are really good at their job and they are amazing support for you as you're going through the journey. Another Claire, we match competitors' rates. We don't have to do it very often, but when we do, we definitely will match competitors' rates. So we welcome for you to look elsewhere. If you're not sure, definitely take a look and then come back to us. And one of the last things that I'd like to share with you is that not everyone can get a loan. But I will tell you that every single person that comes through our website and applies, whether approved or declined, will get a call from us. We've got a team of people who call everyone that didn't finish the application, everyone that may have been declined. Everyone on that side gets a phone call. That team is solely there to help you to get approved. It's to talk to you about why you may have been declined. It could have been that you maybe mistakenly put 50 instead of 50,000 for your income. It could be that you put in your married name and your credit report is underneath your maiden name. There could be so many factors on why you weren't approved. We're there to walk you through it. We're there to help you. Could be that you need a co-applicant. But if all of those things fail and you need a loan, is going to be through the friends and family loan. I love this. It warms my heart every single time I have a patient use this, because patients are always hesitant to ask a friend or family member for this, and family and friends are always willing to do it. It's amazing. Watching them step up, they say things like, I've heard, I love this because I've offered you many hugs and an ear and a shoulder, but this is giving me the opportunity to help you in a lot of other ways, and that's with the loan. So this would be where your friend or family member get the loan on your behalf, and then you get the benefits of it, but they have the loan in their name. It's very helpful. Now, what can we cover? A lot of lenders out there have stipulations on what they can cover. I kind of say that this slide is not necessary because the only thing you need to remember about this is that we cover all fertility treatments. That can be surrogacy, legal fees, it can be donation, it can be pretty much anything. So if you have a question as to whether or not your specific treatment is covered, please feel free to use the number that's at the end of the presentation, and I'll be happy to find that out for you. Now, this is the deep breath slide again. So everybody, we're going to be able to see that, let's say you went with a $20,000 loan with us to get your treatment. Your payment is only $405 for 5 years. If you pay that off sooner, your interest rate that we've got here is 7.99, which is an average rate. If you pay it off sooner, that interest rate keeps dropping, right? So this is doable. I'm super excited to have been able to share all this with you guys. I really hope that it's been helpful to you. If you have any questions, please, again, you can start posting them over in comments or under questions. And I would now, I don't like bragging on Future Family, even though I love bragging on Future Family. We've actually got a 4.9 out of 5 on Trustpilot. I would welcome you to go to Trustpilot and look at both HRC and ourselves. It's a great platform to be able to look at true reviews from true patients. And it's also a great way to kind of see that you're not alone in all of this, because these people will actually talk you through a lot of the things that you're feeling and a lot of things that you're going through as well. Now, I will brag on Dr. Becht. This is amazing. She and I were just talking about how thrilling it was to be on the Hoda and Kathy Lee Today's show. And there are so many things that you've done, so many times you've been featured, and you've had so much to share with your patients. And I know this is a passion of yours, and we are all so appreciative that you're willing to share this with us, tonight and on all of these shows. I feel very privileged to know that I'm in the company of someone that has sat with Hoda and Kathy Lee. And
They are pretty fun.
yes, I can imagine. And I would love it if maybe you just told us a little bit more about yourself.
Absolutely. Well, hello, everyone. And first, thank you so much to Jenny and Future Family. It's really a pleasure to be here tonight to be able to go all about the different fertility topics that we have on the outline. But just to tell you a little bit about myself, my name is Dr. Lisa Becht. I'm a fertility doctor here at HRC Fertility. In HRC Fertility, we have a couple of different regions. So I'm in the Orange County region, with my main office being Newport Beach. And I just love being here. I'm actually an East Coast girl, so I grew up on the East Coast in Connecticut. I did all of my medical school training, kind of everything, everywhere between Boston to DC, and then I was in New York City for 10 years at Columbia University. We kind of decided it was time for a lifestyle change, so we came out here to California a couple of years ago, and we just loved it here. A great place to be working, have a family. So it's just a pleasure to be here. I feel like definitely there's that East Coast, West Coast kind of difference. And I have to say the West Coast, I might have to say, is the best coast. So I'm just really excited to be with you guys tonight. So I'd love to kind of dive right in into kind of what we're talking about tonight. So like Jenny said, definitely here at HRC, we are really committed to our patients. Absolutely, really individualized, personalized care is our mission. We also have fantastic, staff members, and absolutely our laboratory. So we have very high success rates. We've been in practice over 30 years. We are always known as one of the top fertility centers here on the West Coast and in the country. And really, we've recently started to affiliate with USC, and that just allows us to have even bigger of a reach in terms of evidence-based medicine, kind of the cutting edge types of technology and care. So we're just excited to be able to offer our patients really the best in the industry. So we have offices throughout Southern California. So like I mentioned, I'm here in the Orange County region. So Newport Beach is our main office. We actually have a new office that will be opening soon, taking the place of Laguna Hills. It's called Mission Viejo. So hopefully in the next couple of months. And then we also have Fullerton. If you're more kind of in the LA area, we have the Encino region with Westlake and West LA, and we also have Pasadena with the Satellite and Rancho Cucamonga. And then very exciting, we actually have a La Jolla office that will be opening soon, and already we have a Carlsbad satellite office. So definitely wherever you are, hopefully you can find an office that's close to you. We also work very extensively with people all around the country and all around the world. So we do a lot of telehealth. So even if you're not directly kind of in the vicinity, we can work out plans where you can often do monitoring where you live and then come to us for the actual treatment procedure. For people that are international, oftentimes we'll have you come here for more of the monitoring. But those are all things we can discuss at a consult. So like Jenny said, definitely we are absolutely all about pride all the time. And so definitely kind of with Pride Month just kind of ending, I thought it was just helpful to go specifically into some of the different treatment plans that we have for anyone that kind of identifies with the LGBTQ plus community. Additionally, these are all of the treatment plans that really any patient might be interested in. So definitely that kind of applies to anyone that's here on the webinar tonight. So you're going to see we're going to be talking about a bunch of different things. And we'll go into a little bit more detail of each one on the upcoming slides. Mm-hmm. So kind of to start off, really kind of our two big kind of mainstream types of treatments that you usually hear about is IUI, which is intrauterine insemination, as well as IVF, which is an in vitro fertilization. To start off with an IUI, that's kind of our less aggressive type of treatment. Specifically, that's really for somebody that maybe doesn't have major fertility issues, for example, in the LGBTQ plus community. Really, it's a way to get sperm up into the uterus to find its way to an egg, to hopefully fertilize that and then be able to carry the pregnancy. So if someone doesn't really have fertility issues, it's a possibility that we might just monitor your natural cycle, meaning your egg that's just going to naturally grow and then ovulate. We're going to track that so we know exactly when you ovulate, so then we can put the sperm up into the uterus with this IUI procedure, to hopefully get a good chance of pregnancy. If there is a fertility issue or if someone's a little bit older, typically we might do some medications. Typically those medications are pills such as Clomid. For certain diagnoses like polycystic ovary syndrome, that might be something else like Retrieval. Really, injections that you might have heard of in the past, kind of the crazy multiples. Back in the day, really we don't do that as much anymore here in the United States. So if someone needs higher level injections, usually we would do IVF. But the point of the medication with the IUI is to try to just increase the number of eggs that are available for the month to fertilize with sperm, with the thought being as you get older, for example, if someone's 35, maybe only 1 out of every 3 eggs is a good egg. So if we only have 1 egg coming out in a month, the chance of that actually being a good egg to become a fertilized embryo and get you pregnant is just lower. So if we get maybe 2 or even 3 eggs, we've now increased that chance somewhat, while the chance of twins or triplets is pretty low. So those are all things that we're considering an IUI. At your first consult, we go through your full history, we do testing and just see what makes the most sense for you and your body. And then IVF, that's definitely on the other side, that's definitely a more aggressive approach. That is an option depending on all different things. So specifically in the LGBTQ plus community, definitely if we are going to be using a surrogate, we need to create an embryo so then that embryo can be placed in the surrogate to get her pregnant. And we do that through IVF. Really for IVF, it's also a way if someone has fertility issues, the IUI is a much lower chance of pregnancy. So IVF is a much, much higher chance of pregnancy because of all of the things we do in the laboratory. Like I mentioned, as we get older, many of the eggs, unfortunately, are not good eggs. And so IVF allows us to have you literally take injections for about 2 weeks, get many eggs in your ovaries to grow. They're then taken out by a procedure called the egg retrieval. That is something you can see kind of in this picture, that basically it's a transvaginal ultrasound. The doctor sees everything on the ultrasound screen, and under sedation, the needle goes right through the vaginal wall into the ovary and pulls the fluid with the eggs out from both sides. And from that, in the laboratory, that's where we're really going to increase your success, because we're going to be able to see which are good eggs, which are not. Any of the good, what we call mature eggs, are then going to be able to be combined with sperm. We usually use a process called ICSI, which is intracytoplasmic sperm injection, where the embryologist will take the best, fastest moving sperm and literally inject it into the egg, which maximizes the chance of an egg and sperm actually combining to become an embryo. Those embryos are going to then grow for about a week in the laboratory. Some of the ones that aren't as good, unfortunately, are going to kind of drop out, but the ones that make it to the end is what we call a blastocyst embryo. It has over 100 cells. And with that, typically we will do PGT, which is pre-implantation genetic testing, where we're going to take a few cells from the outside part. That part would become the placenta. We are not going to touch the cells that are in the inner cell part, which would become the actual baby. And by doing that, we can do full chromosome testing for you. So everything from Down syndrome to other kind of smaller or less hard types of chromosome conditions. With that, we will know the gender if you wanted to know, or we could keep that blinded. And additionally, if you have any other major genetic mutations that you know about, for example, a family history, or as part of your workup, we will do genetic screening for you, as well as the sperm. And so with that, if there's anything else we need to test for, we can check the embryos as well. So in doing all of that, we're really getting very high quality embryos that have very high chance of success of hopefully leading to a pregnancy. Additionally, miscarriage risk is going to be at least 50% less because we know it's a normal embryo. So definitely when we're trying to decide IUI versus IVF, it really depends on a variety of factors. And that's what we would discuss at a first consult and be able to discuss even further once we've done testing. Really interestingly, specifically for the LGBTQ plus community with IVF, sometimes, for example, a lesbian couple wants to do IVF to do what we call reciprocal IVF, meaning one woman will go through so we can get her eggs harvested like we spoke about. Those eggs are combined with sperm, we make embryos, and then the other woman can actually carry the embryo, which is exciting, so they're both part of that process. So really IUIs, IVF, both great options, really depends on exactly kind of what we're doing. And so that's kind of the mainstream types of things you might hear about, but I'm really excited to tell you about one other option that's almost a blend in between them. So that is on our next slide. It's called Invisal. So you may or may not have heard about it. It is something that's been around for a while, but it's really gotten more popular in the last couple of years. So we've been doing it here at HRC for the last couple of years, and we've actually had good success in well-chosen patients. So Invisal is similar to IVF in that you're going to do injections to try to get multiple eggs to grow. It's the same with IVF that we're going to then do that procedure to take the eggs out. What's different is once those eggs are taken out, we're actually going to put the eggs and the sperm together in this little device that you see here. And literally, they're going to do their own thing just in that small device. And then this is the interesting part. It will then be put back into the woman's vagina to literally be her own incubator for 5 days. So we're bypassing the IVF lab. So we are not doing the ICSI. We aren't throwing out embryos and watching them in the lab. We're not doing the chromosome testing. Rather, it's a more natural process. And then on that 5th day, you will come on back in. We're going to take it out. At that point, the embryologist will be looking for embryos. And then from that, the best quality embryo could then be placed back as what's called an embryo transfer to get you pregnant. And the extras would be frozen. So definitely the success rate is very dependent on somebody's fertility history and age. This is a perfect option, for example, for that lesbian couple that wants to do more of kind of a reciprocal IVF. We call it reciprocal Invisal. So one of their eggs, one of them can carry the Invisal for the 5 days, and then someone would then be doing the transfer to then actually be pregnant. So definitely for someone who's good fertility, who's younger, that really we just need to get eggs and sperm together, this is a great option. Definitely if someone gets older, if there are major egg problems or sperm problems, the concern is we're not getting any of the advantages of the IVF lab. So the success rate on this could be a lot less if we're not choosing kind of people with hopefully higher chances. But this is definitely something to be considered. Again, it will be discussed at your consult based on your specific history and story and age and everything. But something that's definitely very interesting. You're kind of seeing a little bit more kind of on social media nowadays. And again, we have good success. And then the next big thing I always love to talk about to anybody, but specifically, if we're talking about LGBTQ plus community, fertility preservation is such an important thing to be aware of. So whether it's someone wanting to freeze eggs or freeze sperm, or basically freeze an embryo, meaning you're doing IVF, we're going with the injections, taking the eggs out, making embryos, but then the embryo is being frozen with intent to use it later rather than getting pregnant, with the transfer. So this is something so important, again, to anybody who's not really sure, what the reproductive kind of pathway is going to be, just because as we get older, definitely more kind of quicker on the female side, but also on the male side, eggs and sperm, their quality goes down. But really specifically, if someone would be transitioning, ideally doing this before starting hormones really just keeps all of your options open for the future for your reproductive health. If you've already transitioned, you're already on hormones, it's not too late. It would mean, though, typically we have to have you stop the hormones. It could take a couple of months off of them to either get the eggs to kind of be ready or to get sperm to kind of regenerate. But you could then freeze or kind of obtain samples that way. Egg freezing and embryo freezing literally are IVF. Egg freezing is the first part of IVF. We just are not combining with sperm yet. Sperm freezing, much easier. It's giving usually a couple different collections, and then that's going to be frozen into different vials. And then the great news with freezing, it's actually liquid nitrogen. It's called vitrification. So it's just as good in a year, in 10 years, technically we'd say indefinitely. So it's always something we say anybody should consider, but definitely, in a specific case of someone's transitioning, definitely to consider this ahead of time. So those are kind of all of the big treatments. And then, the big important thing is we need all of the different parts. So we need sperm, we need eggs, and we need a uterus. So if we're needing sperm, we need to get donor sperm. Typically, a lot of people use an anonymous sperm bank. Some of the big ones around here is California Cryobank. But even when I was on the East Coast, that I would still say that's the leading one. Lots of other ones, Fairfax, Seattle. There's smaller boutique ones. So if you're looking for donor sperm, check out a couple different websites. You'll see that some of them give you more pictures. Some of them kind of give you more like personalized information. All of them, though, have very, very strict criteria to be able to donate sperm. So those men have been fully screened for medical, family history, genetics. They have full screening done, so you're picking high quality, healthy sperm. When you're picking that sperm, definitely work with your doctor just to make sure you're picking the correct sperm, because there's different types of vials depending on what type of treatment you're doing. And then in terms of just being compatible, with IVF, we actually, nothing kind of is really that specific genetics wise. Usually we do that genetic screening. If you are a carrier of something, you ideally want to pick sperm that is negative for that, so you don't have to do extra testing of the embryos. But definitely if you're doing something like an insemination IUI or Invisal, where we're not doing full kind of segregation in the lab, you do want to check for cytomegalovirus, which is just something a lot of people don't ever know they've had. It's kind of like mono, but there's a theoretical risk if you've never been exposed. You wouldn't want to get sperm that's positive, because you could theoretically get that in early pregnancy and it could cause a birth defect. Whereas with IVF, everything's very segregated, so there's no risk for that. So that would be anonymous sperm. A known donor would be another option. Definitely, is an option. It's a little bit of a harder option oftentimes. Typically, to do it legally, kind of, keeping it as more of a donor and not ever having to worry about paternal rights. Typically, we would have that known donor go through a sperm bank, give a collection. They do blood work like HIV and hepatitis. It's then quarantined, and then that donor has to be checked again before that sperm can be released. But that would be the best way legally. The big thing on the known donor is more the psychosocial aspect of it. If it's a family member or a friend, kind of what is the relationship of that person to the child going to be? But that would be something, again, we'll talk fully about at a consult if we're trying to get sperm. And then the next big thing we're going to talk about is donor egg or egg donation. So this is definitely, if we need eggs, for example, for a gay couple, definitely, obviously, we need to go this way. Or sometimes for a female, if she's older or she's had failed fertility treatments or for certain medical conditions, sometimes we need to use a donor egg. For eggs, again, different places to get them. Most commonly, we again do anonymous. Really nowadays, there's two major ways to get anonymous eggs. The first would be fresh cycles, which is kind of our typical kind of way that you might have heard, for many years, where a donor will cycle through the IVF process we discussed. On the day her eggs get taken out, they are put under the intended parent's name, combined with that sperm, and at that point, it's, like you said, fully anonymous. She would never meet that couple or person. They would never meet her. And basically, they have very high success rates because usually our donors are in their 20s. Again, they are fully screened. They have very high criteria to become a donor. Because of that, typically we get many, many embryos with very high success rates. So if you're only looking for one pregnancy or sometimes just two, sometimes we actually would recommend if you do what's called a split cycle, meaning if you're doing donor eggs, typically, again, she's young, really fertile, usually get 20 to 30 eggs. And that could lead to many, many embryos. So probably more embryos than you might need. Sometimes people do what's called a split cycle, where you're going to maybe take 8 of the eggs or a certain number of eggs that would hopefully lead to at least one pregnancy or two, again, depending on different factors. And by doing that financially, it also can help out a little bit. So that would be kind of the classic fresh donor that you might have heard about. Usually you go through an agency to find those donors. It's a little bit more concierge in that you can give exact specifics, and they usually will find that donor for you, though it is a little bit of a longer process. They have to find the donor, screen the donor, make sure she has a schedule where she can do the IVF. But I would say that, in terms of all of the different things, is kind of the gold standard. We do see slightly higher success rates off of the fresh donor eggs. The other option, which has gotten a lot more popular, especially with COVID, has been frozen. So frozen eggs has already gone through that whole process. The donor, again, had very high criteria to be chosen. She already cycled, but on the day the eggs were taken out, they actually were frozen and then are at an egg bank. The way egg banks run in the United States, usually a fertility center actually partners with one. So we're partnered with Fairfax Egg Bank, which is a very high quality egg bank. We actually have such high success rates. We also are what we call a production site for them, meaning any donor in the Southern California area actually usually comes through one of our HRC offices to freeze the eggs. So we know that they're being run very kind of well, very technical expertise in egg freezing. So we have good success rates from them. But again, all patients can look through their whole egg bank. It's all online. Pick eggs. They may or may not have been produced here. They could have been from the East Coast or where not. But basically, with frozen eggs, you can pick a certain number that you want to buy. They get shipped to our office. They get thawed and then combined with sperm. Typically, we would say that the kind of survival rate is about 92%. So sometimes maybe an egg doesn't survive the thaw. And then when we go through the whole process, we would typically say that it is still very high success, but maybe a couple percentage points less than a fresh cycle. So it's something to kind of weigh, how many pregnancies are we looking for, just to make that decision as to what makes the most sense from more of a financial side. But one of the other big pros to using frozen is if you're trying to kind of get into the process quicker, you could literally tonight buy some eggs, again, with appropriate medical screening from us to make sure they're compatible, and they could get shipped here, whereas going to find a fresh donor could take a couple of months sometimes. So those are kind of the different options to get an anonymous egg. Just a kind of FYI on the anonymous part, again, it is fully anonymous. So one thing that sometimes takes away a little bit of that kind of anonymous part of it is something like a 23andMe, where in the future, if your future child was to go on something like that, it is possible they could be linked kind of to this donor. So it's something, just now with everything kind of changing with that type of genetic information to be aware of. As part of your treatment at HRC, we have a fantastic social worker who's a counselor and therapist. So sometimes patients using donated gametes, meaning donor egg or donor sperm, might want to talk to her. It's included in the treatment. How are you going to explain to children, kind of all of those types of questions that are very helpful. And then lastly, in terms of donated eggs, the other option would be to use a known donor. Definitely a little bit more of a process than kind of the sperm, in that this donor is going to have to go through all of the screening, and then she's going to go through the cycle with us. That is IVF, taking all the injections for the 2 weeks, getting the eggs taken out. So it's definitely a more involved process. With that, definitely before kind of moving forward, absolutely get legal kind of contracts for both you guys. And then the big thing again is that psychosocial aspect, especially when maybe she's a sister or someone very close. What is that relationship going to be between her and that future child? But all different great ways to get donor eggs. And so again, that would be something based on your needs and your history. At a consult, we'd be able to go through everything in detail and kind of get you set up to start looking for eggs. But the great news is with all of these, very high success rates. And then just to kind of play off the last part about donors, we actually donor embryos as the last option. So a donor embryo is essentially adopting an embryo. So the egg and sperm have already been combined. Typically, most of them, if you're going through a high quality agency, so example, in Orange County, we use Donor Nexus. That's the agency that holds all of our donated embryos. So they're all very high quality embryos that have been PGT tested, meaning they've done the chromosome analysis. So you can get the information on things like ethnicity, education, medical background of the egg and sperm that created that embryo. And then we'll know, is it a boy, is it a girl, if you want to know, as well as the grading. And so you can work with your doctor to kind of pick up the best embryo for you. And so the great thing about donor embryos, they're already created, so it's the fastest of all of these different processes that we've discussed. Definitely, typically a high success rate if it's been PGT tested. Another way to kind of truly adopt an embryo is through some of the more national ways to get embryos. So nationally, some patients will donate they're kind of the biggest one here in the United States, is called snowflakes. They basically run almost like an adoption kind of agency. So there's site visits, there's a lot more kind of screening of the intended parents. Just the way it's run, they typically are not PGT tested. They also typically not kind of as high quality, depending on where they're coming from and what the criteria was to even freeze them. But that would be another option to consider. And really, donor embryo, like you said, it's great in that they're already created. You know exactly what you have. It's probably the fastest of all of these different processes. That being said, if you wanted to use your own eggs, your own sperm, depending on the situation, this is an already created embryo. And then lastly, in terms of all of the things we said we needed to be pregnant, we talked sperm, we talked eggs, now we need to talk about a uterus. So surrogacy is kind of the last piece of the puzzle. That is the uterus that is going to carry the pregnancy to lead to hopefully a live birth of a baby. So kind of the true old, kind of the real definition of surrogacy was actually that woman using both her eggs, getting pregnant with her own eggs, carrying that baby in her own uterus, and then giving it to someone or another couple. That kind of very classic definition of a surrogate really is not something we do here in the United States anymore. Instead, the intended parents is typically their egg and or their sperm, or an embryo that they have adopted, but it's that intended parent's kind of embryo, or that is either being made by IVF or being adopted, that is then placed by an embryo transfer into a different female's uterus. And so truly that we would call a gestational carrier. But typically nowadays we would call it surrogacy, but it is by definition a gestational carrier. So in terms of picking a gestational carrier or surrogate, definitely different places you can find one. An agency really is the gold standard place to find a high quality surrogate. They've done extensive screening, background screening, medical screening. They have great support. They are following that surrogate, making sure she comes to testing, takes her meds, goes to all prenatal visits. So that really would be gold standard. Unfortunately, there is kind of more expense to that with the agency fee, but I truly think that it's worth it. Much higher quality surrogates. It includes all the legal parts of things. So that would be the recommendation. Or if you know somebody, that also can be a great option. Kind of hear about people finding kind of surrogates on Facebook and things like that, but definitely really recommend against that. But definitely first and foremost is finding someone to hopefully be the surrogate. They go through extensive screening. They're carrying your precious babies. We want to make sure that this person is younger, fit, has proven full-term pregnancies in the past, no major medical problems, no toxic habits. So they get full screening. We screen them as the last kind of part before you match. And then you do legal and psychosocial evaluation to officially match with your surrogate. A couple of things with that matching process that are very important is making sure that you're on the same page. If you're trying for twins, COVID vaccination, all of that. The transfer process is very easy and quick, very high success rates depending on the quality of the embryo. And then that person would carry the pregnancy through and deliver. And typically there's great relationships between intended parents and the surrogate. So I know it's kind of a whirlwind. Like Jenny said, definitely take a deep breath. It is definitely a fountain and a hose. Yep. But this is just kind of a huge, broad range of everything kind of we talk about. So if you were interested in any of this, definitely you can make a consult. We'll be able to go into full detail, very personalized to you and your situation. And with testing, really be able to tell you a lot better what your success rates would be and kind of more specifics like that.
Yes, yes.
As I said, I'd love to open the floor up to questions.
Yes, definitely. Questions, we love them. So please feel free to put those over, as we were saying, in the comments section or ask a question. Either will work fine. We'll be able to see those. That was one of the most informative webinars. I absolutely love all the information you gave us. It was very user-friendly. And I feel like it's giving us a lot of good information that we'll be able to take and go into the different situations that we are in life and use that information to be able to further grow our families. So super excited about that for all of the people that were able to watch and the people that will watch after the webinar tonight. So if anyone has any questions, and Dr. Becht, if you can think of anything that maybe you realized, oops, I didn't cover that in a slide, please make sure to add that now as well, because I'm sure there's always something that we forget. I know I've got a few. And also the numbers and the contact information here on this slide. The 800 number will get you through to HRC Fertility and new patient appointments and any questions you may have. And then on the right side of your screen is About Future Family. You can scan the QR code. It will take you straight into that application that is risk-free with no worries on hitting your credit and making a negative impact on that. And also, again, feel free to use the phone number and the email address for me as well if you have questions now or after the webinar. So I can tell you one of the things that I usually hear from patients about their treatment, no matter what part of treatment they're doing or what treatment they choose to move forward with, is insurance, right? And insurance coverage is, thank goodness, getting a little bit more widely accessible to patients. And so I would definitely recommend that anyone that is using insurance and they have that is to be an advocate for yourself for that. HRC, the financial coordinators there are literally the best in the industry. Yes, but they're only as good as your insurance person. So when they're calling into your insurance company, they're only as good as that person that they're talking to on the phone. They can't predict any other information. They're given what information they can. So you being an advocate for yourself is very important in that way. And HRC is very transparent about all of their costs, and so you just need to get that same transparency through your insurance as well. Now, I would love to know what you think the most prevalent treatment is when you're trying to grow your family. Would you say starting off with IUI is always going to be pretty much the first step for most parents, or do you feel like moving those test results and moving forward with all of that is how you're going to determine what's going to be the next steps?
That's a great question. It really depends, I would say, on kind of your history, your age, and all of that testing results. Definitely, if someone is younger, absolutely. We usually say if being less aggressive works, definitely we'd love to start with that. That being said, there's a lot of reasons some patients want to go straight to IVF, whether it's medically indicated or sometimes it's more that they want to do the chromosome testing. They want to freeze the extra embryos, not just thinking about a current pregnancy, but a future one. So we work together, myself with our patients to decide what makes the most sense medically. What do you feel the most comfortable doing? Absolutely, there's some patients that based on all of their medical information, I do recommend IVF, but they want to try an IUI to start. So as long as we understand kind of the risk to that, absolutely we would start with an IUI. So at that first consult, I really like to go in depth with my patients. It's about 45 minutes to an hour. We do have you fill out a lot of paperwork and questions ahead of time. So I know it's a lot of info to start, but it really helps me to then in those 45 minutes to an hour, really be able to go in depth on the things that could really impact your outcomes. Go through everything. I love to draw pictures. I kind of love my Post-its. So you're getting a bunch of stuff. We go through things you can be doing even while you're doing the testing, supplements, lifestyle changes, all of that. And then with all of that information, we'll chat again once we get all of the results and make a definitive plan for you. So really, we just want to help you, personalize it to you, and just help you reach your goals in terms of your family.
Yes, and you touched on the embryo freezing and being able to have that grow in your family even further than one child. We here at Future Family also will allow future treatment and past treatment, reimbursement for that in the loans as well. So we support that as well, trying to make sure that everybody has what they need to be able to grow that family. Now, I see a couple of questions here. First, I'll go ahead and answer, will today's webinar be available to rewatch at a later time? Yes. So if you have had audio issues, it typically is on the viewer's side. It happens all the time. And trust me, you can come back. You can watch the entire webinar as many times as you would like. It's helpful because you can actually possibly see the slide completely and fully, and also reread some of the slides because we do go over things rather quickly. So feel free to definitely come back. You'll get a link emailed to you through that email that you gave to the Crowdcast when you registered. Now, I love this question. Can I start a less aggressive fertility treatment and move towards IVF, and would financing adjust? So first, I'd like you to answer the first question, which I feel like you covered a little bit in just now, is that yes, start with the less aggressive if that's what you prefer, and then you can move on to the other treatment. Is that correct?
Absolutely. And again, from your testing, I can give you kind of a generalized kind of what are we thinking your success rate would be with a less aggressive treatment versus a more aggressive. But absolutely, we say, okay, well, let's see. Typically, for example, if you have unexplained infertility, really the studies show that if an IUI is going to work, it works within the first 3 cycles. So typically we would say, let's try up to 3. If you get, decide after 1 or 2 you want to move forward quicker, absolutely. The plan is never set in stone. It's very fluid. We're always changing it based on how you're doing, how you're responding. So IVF can always be the end, or same thing. If we're trying something like IVF, even though maybe the chances are lower because of someone being much older or very poor hormones, we can still try it with the option of a donor egg, again, being kind of the end point. So absolutely, we work with you, whatever you're kind of most comfortable with. Make sure you understand all the options and how that kind of applies. And then from kind of the financing, definitely, like you would expect, kind of as they get more aggressive and more intensive, specifically from the laboratory side, unfortunately, the expenses do increase. So absolutely, having future family is fantastic. Like Jenny said, making sure to advocate with your insurance. A lot of insurances are hopefully starting to cover, for being California, it is, very surprising and sad that we don't have IVF mandate here. But there is a lot of times at least coverage for some testing and maybe IUIs. So like Jenny said, our financial coordinators are amazing. They will run your benefits check. They do a good job getting that. Definitely though, if you can, call your insurance as well, advocate for yourself. If you feel comfortable asking around at work, sometimes at work, you might have a couple different plans you could pick from. So definitely you want to know which one has the best fertility coverage. So all of those things. And then definitely, as you're going through treatment, we're always kind of discussing, if we need to go to a more aggressive, kind of what does that look like? We absolutely understand the financial part is a very hard part of it. Absolutely make sure to keep that in mind. Try to minimize any unnecessary, obviously, procedures. Just try to do everything you can to make it financially feasible for you.
I love that. I love that. And something to consider is that, say you are with a patient and you say, I don't think you'll have any issues with the retrieval, but we may need to do a couple of transfers, right? So you need to account for that. At Future Family, what we do is we encourage you to borrow what you are able to borrow. So do not overborrow. Do not feel uncomfortable and borrow enough to do 4 rounds of IVF if you can't afford that payment, right? So keep the payment in a reasonable area for you financially and soundly. However, definitely think ahead a little bit and think about, would I like to have a little bit of extra funds for a second child or second try for that, second round of transfer? Or would I like to go ahead and plan for a second child and go ahead and get the loan for that now? So these are all things that we'll discuss with you and make sure that it's a healthy financial decision for you, not just, we're not a predatory lender in any way, shape, or form. As a matter of fact, some people have even said it's the polar opposite with us. We're here to truly support you, and not just with the financial side, but also with that fertility coach and all of the other areas that we help you out with as well.